ADHD, is that what your child is being labeled with? The inability to sit still, concentrate, or control impulses is being met with an array of medications that are numbing our children. Is Ritalin and others like it really the answer to ADHD? We're going to talk about that and more today at Sunflower Shop. Not everyone agrees with treating ADHD with medications is a good idea. Joining us today is Dr. Mary Ann Block, founder of the Block Center in Hurst, Texas, and author of No More ADHD. Thanks for being here today, Dr. Block.
Thanks for having me, Brian.
Let me ask you, when you hear the label ADHD, what does that really mean to you?
Well, ADHD, of course, stands for Attention Deficit Hyperactivity Disorder. And it is a psychiatric label that is based completely on subjective symptoms. So it's diagnosed with a checklist of these subjective symptoms. And each one of the symptoms starts with the word often. Now, often is a very subjective term. If we think about it, if a child misbehaves, you might think often is 3 times, and I might think often is 20 times. So that is why this is such a subjective diagnosis. And there is no objective way of diagnosing it. So when people say you go get tested for ADHD, they need to understand that it is simply a checklist of symptoms. And those symptoms, having those symptoms to me doesn't mean you have ADHD. To me it means whoever made the diagnosis didn't take the time to figure out the real underlying cause of those symptoms.
And what are some of those underlying causes?
Well, there's a multitude of them. Diet is extremely important. Nutrition and allergies, that surprises a lot of people. And learning problems is probably one of the biggest ones as well. A child who learns differently in the classroom than the teacher is teaching is going to have difficulty no matter how bright they are and how capable they might be. They just can't learn, and they're going to fidget and move around and get frustrated and angry.
So how do allergies play a part with ADHD?
Allergies affect every part of our body. We think of allergies as, allergies to trees and weeds and grasses and things like that, and they cause runny nose and itching or maybe even asthma. But those same allergy cells are also found in our brain. And so you truly can have a brain allergy. And allergy reactions can be different in each individual. I've seen families where 3 children have come into the office, and one has asthma, and one has eczema, and one has brain allergies and behavioral issues from their allergies. And the Annals of Allergy, which is a very reputable allergy medical journal, has published an article that says kids with allergies perform less successfully in school across the board in all ways. And of course, here in the Dallas-Fort Worth area, we got lots of allergies. It's one of the top places in the country. And so a child in September might be dealing with ragweed, in the spring with grass and trees, and it looks like they're having school problems, but they're really having allergy problems.
I see a lot of clients, and most of my clients, I'm always talking about controlling blood sugar. How does proper diet and controlling blood sugar really affect with ADHD? I
really think that's one of the most important things that parents can consider. Blood sugar, low blood sugar, and the kid says, oh, does that mean I get to eat more sugar? I'm like, no, it means you need less sugar, because eating sugar and artificial sweeteners actually cause a reactive low blood sugar. And when that happens, the body releases adrenaline. And adrenaline instantly raises the blood sugar back to normal. So you don't even bother doing a blood test because it's going to always be normal. But the problem is that adrenaline now is in the bloodstream, and adrenaline is the fight or flight chemical. And so we have a child who's had sugary cereal for breakfast, and an hour later they're sitting in class and they're supposed to be sitting still and focusing and paying attention, and they literally can't because that adrenaline is on board, and it makes them want to fight or run. And so changing the diet is the first thing that I always recommend to my patients.
Do you use any nutritional supplements in your ADHD program?
I do. I recommend nutritional supplements for everyone. I think there are lifetime supplements that people need to take forever just to keep the body working. Every single biochemical process in our body is dependent on vitamins and minerals to go from point A to point B. And if we don't have the right supplement there, we don't go from point A to point B, we might go from point A to point Q, and things don't work right. And so there's a lot of information in the medical literature about supplements for symptoms that get called ADHD. One of them is DMAE, which is a neurotransmitter precursor. Over 50 years ago, it was published in the Journal of Pediatrics that it can help literally every single one of the symptoms that we now call ADHD. One study found that vitamin B6 worked better than Ritalin in a group of hyperactive children. There are studies on essential fatty acids, the fish oils. Magnesium has a calming effect. Those are probably my 4 favorites.
What would you tell parents right now? Give them a couple of tips on what do they need to do right now to get started on the path to helping their children with ADHD?
Well, first of all, I don't even use the ADHD label because it's psychiatric, and I don't believe these kids have psychiatric problems. They have dietary, allergy, learning problems. But first of all, they need to look at their child's diet. I have them start the day with protein only for breakfast. So that can be, bacon, eggs, sausage, or it can be a piece of chicken from dinner the night before, and water, because the lactose in milk is a sugar. And so we keep all the sugars out of the diet there for breakfast. I write prescriptions for them to have a protein snack mid-morning and mid-afternoon, which might be a handful of nuts. I recommend they get all sugar and all artificial sweeteners out of their diets. No, it doesn't mean they're never going to eat sugar again, but they don't need to be eating it as often as we let the kids eat it today. And it's not unusual for parents to see dramatic changes just doing that.
Dr. Block, that's some great information. Thank you so much for being here today.
Thanks for having me.
To learn more about ADHD and other health topics, come see us at Sunflower Shop, where great health is just a way of life.